everybody. Welcome back to another episode of Hybrid Healing Hour. Today, we're going to be discussing a very important female topic, vaginal health. And I have one of my favorite midwives here, Kathy Fair. So why don't you go ahead and, even though you've been on before, introduce yourself and tell us a little bit about where you are and how you got to where you are today.
Well, thank you for having me back. I really appreciate this. And my name is Kathy Fair. I am a nurse midwife, nurse practitioner in Boca Raton, Florida. And I am a women's healthcare nurse practitioner. I mean, it's my passion. It's what I love to do. So when you called me and asked me to talk on this great topic today, I was super excited. So thank you for having me back.
Yes. And our first episode we did together was on everything regarding pregnancy, right? And prenatal, during natal, and postnatal, right? So go back and listen to that if you haven't. I learned a lot during that podcast.
And that was a lot of fun to do.
It was.
Yeah.
So I'm really looking forward to this. And we may as well just dive right in. I mean, right off the bat, I just want to talk about, like, what is vaginal health and why is it so important?
Well, it is such an important topic to talk about because so many women suffer with vaginal issues and they're so afraid to talk about them. And if they're not, having a good relationship with their provider, sometimes they'll go months, years without treatment or, without being able to talk to someone that they feel confident to talk about and comfortable to talk about. So, and it's a big issue.
It is. People don't realize that we have gut, we talked about gut flora in our other podcast, and we have bacteria everywhere, right? And the vagina is not looked at as something that's necessarily clean, but we do need to keep it somewhat clean. But going on to that topic, what do you feel when somebody does have issues? I see all these over-the-counter products like douching. What's your opinion on that?
So that is a huge thing that we talk about with our women on a daily basis because women really think douching is a great thing for their vaginal health. Right. And they feel it's very refreshing to them and it makes them feel clean, almost makes them feel refreshed, right? And it's totally the opposite. We do not encourage douching. We tell them not to douche. In fact, when you douche, you're wiping away your normal protective mechanism that we have in our vagina, right? So we have normal, healthy tissue. We have normal, healthy flora, and that's what our vaginal microbes are all about. And it's keeping our pH at a safe level that can protect us from getting infections. And when women do frequent douching or they use a lot of these deodorant products, because they want to smell fresh or they want to feel good, what they're actually doing is hurting their normal flora and making them more prone to infection.
Right. And I'm so glad you mentioned that because that's one of my, I guess you could say pet peeves. I'm like, no, I know they have tons of those pH balancing products over the counter, like soaps that you can use, body washes and things like that. I'm like, no, you really should just avoid all that. Your body, doesn't the vagina self-cleanse?
It does. It's supposed to, right? Because we have that natural mechanism that does that. But for some women, they grew up thinking that this is what they have to do to keep their vaginal health and keep their vagina clean. And it's totally opposite of that. So it's just a lot of good education. But I will tell you that so many women think douching is a good thing.
Yeah. So I've noticed as well with menstruating females, like even if they did have a infection, a little odor or itching or something like that, but then if they end up having their period, a lot of their symptoms resolve. They go away because I feel like that's one of the natural cleansing mechanisms of the vagina and our cycles and our hormones.
And that is so true. And women will come in to us and say, well, every month I get this specific symptom, right? Right before I'm about to get my period or right during my cycle or things like that. And I need to be treated for it. And when you actually educate them and tell them that this could be a normal process, right? It's part of what happens to our hormones. And we don't have the same hormones daily. As women, cyclically, our hormones change all the time. And certain hormones also interfere with our vaginal pH, right? So right as we're about to get a period, our own progesterone levels, they increase, right? They soar. And what they do is they reduce our normal flora, which is our lactobacillus. And when you reduce that normal flora, it's making you more prone to infection. And women don't realize that. And that's just part of the natural process. So that's why their symptoms might come right before they're about to get their period. And then during their period, what actually happens is the blood itself raises the pH in the vagina. And that makes the pH to become more alkaline, right? And when you have an alkaline pH, again, it's going to make you more prone to infection or more prone for that bacteria to grow.
Right.
And then their cycle's over, post-menstruation. Their estrogen levels start soaring. When their estrogen levels increase, it's increasing your lactobacillus, again, back to its normal way it should be, and the symptoms resolve. So that's why women tend to have those certain symptoms during their cycle. And again, you got to talk to them and you've got to educate them. This could be a normal process for them because this is what their hormones are doing. Nobody's hormones are the same every single day, right? And we've got estrogen, we've got progesterone, we have testosterone. We have so many things in our body that women don't realize really affect the pH of our vagina.
Right.
And our pH is the key. Right? We want to keep our pH slightly acidic. I like the pH to be somewhere between 3.8 and 4.5. But when certain things that we do on a daily basis interfere with that, then it changes the pH and makes us more prone to infection.
Right. And so with that being said, I mean, I have so many questions. I love this talk. So what about, we talk about sexual partners, right? And if there is... like a male's pH coming from their semen can definitely impact our flora, or spermicide on a condom or whatnot. So have you seen people who have some reactions and they're like, I think I'm allergic to my partner, or do you recommend or not recommend spermicide, etc.? Or different lubrications even?
100%. Everything changes the pH, right? But on a daily basis, that's going to change for women. And so, again, it's just talking to them. Women that have frequent, or I should say multiple sexual partners, they tend to get more infections, right? Because the vaginal pH changes on a daily basis. Condoms are extremely safe. We want, women to use condoms. We want them to protect themselves against STIs and other things. But the spermicides, which are being used to kill the sperm, really aren't healthy for our vaginal health, right? Because what it does is it ruins or destroys our normal flora that's there, and it sets us up for infection after infection and after infection. And what happens with women if they come in and they complain about discharge or they complain about odor, specifically odor after intercourse, right? And that's one of the key symptoms of a bacterial infection called BV. So they want to be treated, and they want to be treated right away. And we treat them, and then they call and they said, I'm not better, and they want a different cream. And we keep treating them, but we're not actually replacing or restoring the pH to where it needs to be. And unless we actually can do that, they're just going to keep getting frequent infections.
Right. Perfect. And I think people don't realize too, and I always ask this question as well, are you using spit or lubrication? And if you're using any toys, are you cleansing them before? Because, you just need to keep everything as clean as you can for our own pH balance. And I think a lot of people don't think about that.
Yeah, 100%. Toys specifically, they have to be an appropriate, toy for vaginal health, and they got to clean them appropriately.
Yep.
Same with sex, right? Different types of sex, anal versus vaginal. A lot of women don't even realize that. And the route is extremely detrimental to our vaginal health. So if they have used anal sex first and then go to vaginal sex, they're introducing so much bacteria from the actual anal canal into the vagina, and they're creating and setting themselves up for huge infections. So again, that's just education to these women. I mean, there's different preferences. Everybody has their own preference. That is fine. But we want to make sure that they do it in the appropriate order, right?
Exactly.
And I know a lot of women are afraid to talk about that, but it's real.
That is why we are here today, Kathy, because this has to be talked about. Exactly. I want to get down to
they come in all the time. Why am I getting this infection? And when we get down to the nitty gritty, we find out.
Yeah.
And because they are so comfortable with their provider or with me or my partner, partner, they're able to discuss those things. And that's how we can really fix those.
People have to realize this is our jobs. We're not going to judge you. You can do whatever you want. We're not there in the bedroom watching you. You need to be able to tell us exactly what's going on so we can figure out how to help you. And so, we can also laugh about it and have fun with it too. And you don't have to be embarrassed by any means, right?
Yeah. And it's just about hygiene. And they don't even realize that.
Right.
You can, engage in any type of sexual preference that you want. We just want you to be safe, and we want good hygiene from it.
Yeah, I think there's some misconceptions about vaginal health. People always think, I don't want to talk about it because I feel dirty, or I'm embarrassed, or I have to tell them what I've done, or there's some shame to it. But women don't need to be shameful of this, because not everything is an STI or STD, as what you used to know it as, sexually transmitted infection. But and if it is, hopefully we can treat you. We can discuss how to prevent this from happening again, and stuff happens, right? So whether you
It sure does, and it only takes one time. Right? They're like, what do you mean I have this? I only, had sex one time. It only takes one time. So just little things that we want them to be comfortable with and to talk about.
Exactly. Thank you so much for touching on that already. I liked how we really jumped right into this.
We have to.
Yes. So why don't we go ahead and let's backtrack a little bit, and let's talk about different vaginal conditions you can have. Like, I think the most common ones are like bacterial vaginosis, and yeast infections are the two most common. But what else would you see in your office?
Well, same thing is we have, women coming in all the time complaining of either itching, burning, irritation, discharge, odor, all different symptoms, right? And they're not sure what was going on, right? So you've got bacterial.
Yeah, and I'd say oftentimes people call and having those symptoms, they're not even sure if it's vaginal or urinary tract infection. Right?
Yes. And they'll call frequently and say, I have a urinary tract infection. I want to be treated over the phone. I have burning with urination. And we may treat them. And then a week later, they're calling back and their symptoms are still there, because it may not be a urinary tract infection at all. Mm-hmm. Something can be totally coming from that vagina or the vulva. Mm-hmm. What I did see recently with a patient is she really thought she had a urinary tract infection. And her symptoms weren't improving with the antibiotics that she was given. When she came in, she actually had a herpes outbreak. Wow. And she had those lesions that were on the vulva, which is on the outside.
Which is right where she urinates.
Exactly. And they're open lesions. And when she was urinating, that urine is so acidic, it was burning, but it was actually burning the vulvar area. And so what I say now to patients is it actually burning when you urinate, or is it burning when the urine's hitting the vulva? Because two separately different things. And you don't necessarily have to have herpes. You can just be so irritated from a yeast infection, and you're itching yourself so badly that you actually create little excoriations. And so when they urinate, it burns. Mm-hmm. And so I always encourage them to come in and get checked out so we can differentiate between all the different types of infection. All right. So urinary tract is one of the big things, but what we see on a daily basis is a bacterial infection or a yeast infection.
And those are
so
not
we try to culture
considered,
for that.
And those aren't considered STDs, correct?
Correct. No.
Okay.
A bacterial infection, some people are misunderstood with that. They really think a bacterial infection is an STD. It is not. We get BV or Gardnerella or so many different bacterias from just daily living. Mm-hmm. Same
Which
with
is
yeast.
Basically, both of them are just conditions of a change of your pH balance, right?
100%. Yep.
And so we have to restore it. So sometimes you do have to treat it. Just restoring the pH alone might not get rid of it, or get rid of it, quote, like necessarily as fast as people want it to, right? But sometimes those can be self-limiting. Is that correct?
Yeah, every woman wants a quick fix, right? I'm going on a cruise this weekend. You need to fix me. I'm, going out of town. I need to be able to, have sex, and it's not a quick fix, And a lot of times what we do is we do a vaginal culture, and we do a vaginal culture to differentiate between bacterial and yeast? And if it is bacterial, what kind of bacteria? Because this is such a big thing now, is that for years we've been treated with certain medications that our bodies have become resistant to. So there's so many different bacterias that are resistant to certain medications. So I always say I want to get the culture back so I know what I'm treating and I can treat you appropriately. Because I'm going to give you a dose of medication and then a week later you're still symptomatic because it's not going to work. And that's the same with yeast. There's so many different yeast strains, especially here in South Florida, where it is hot climate and we're sweating a lot and we're exercising a lot. There are so many different types of yeast that we really need to determine what type of yeast it is so we can treat it appropriately.
So you're finding resistance, and the go-to I've always known for bacterial vaginosis is Flagyl or metronidazole, which comes in an oral form or a gel form. So you're saying that you're seeing where that's not working.
I am 100% saying that it's not working because we've built up resistance to it throughout the years because we used it so often. That was the number one go-to for BV. That is what we always used. And now we have so many better medications that are available, which are going to work more effectively and treat it. And so we can get rid of the infection and not, prolong it.
Okay. Wow. Can you go ahead and touch on what are some of the symptoms of bacterial vaginosis? Like is it a different kind of discharge or whatnot?
Sure.
Describe what that is for our audience.
Well, women with BV tend to have a more thinner discharge. They almost describe it as a watery, almost grayish type discharge. They tend to have odor with it. Odor's what the biggest complaint. And a lot of women complain about odor after intercourse, or their partner says that they have a foul smell after intercourse. And so that's one of the key symptoms of a bacterial infection.
But unfortunately, it can also be slightly itchy sometimes too.
Yes, so that's a big misconception. Thank you for talking about that, because we used to think itching only went with yeast infections, right? Oh, if you have white discharge and you have itching, you have a yeast infection. If you have a thinner discharge and you have odor, you have a bacterial infection. But both of them can go hand in hand. And what I find, truthfully, with a lot of my women, if they have both. And so you culture and they come back positive for yeast and bacteria, and you end up having to treat them for both at the same time.
Right.
And another big go-to, as you know, with women with yeast, they want the oral. They want diflucan, right? Because it's convenient. It's 1 or 2 doses. They don't have to use anything intravaginally. And what have we found? That all the yeast strains are becoming resistant to that as well, because again, it was our number one go-to. So a lot of times I'll tell women, well, I'm going to give you a vaginal preparation. Oh no, I want the oral. And I said, it's not going to be as effective. And so sometimes, again, it's just talking and educating women.
Right. And this is why I send to you sometimes, when it's not getting better, I'm like, go see Kathy.
Thank you. Yeah, because we deal with a lot of chronic conditions, right? And a lot of just recurrent infections.
And that's unfortunate because no women want to go through that. It's uncomfortable, right? It doesn't feel good. Typically, you just feel, and that's the most, I think, vague description ever. I get it all the time. I just don't feel comfortable down there, right? That's
I feel off.
Right.
That's the word they use. I just feel off. It's not right.
Yeah.
It's not normal. They can't describe anything else. It just doesn't feel right.
And then back with, I know, like bacterial vaginosis, I've done vaginal exams. I've looked at somebody. I'm like, it doesn't look like this. I don't smell anything, but they tell me they do, and it comes back BV. So they don't even have a discharge per se. So you can, even if you might have one symptom and you might have all of the symptoms, right? And so I'm so glad we're able to touch on all of this.
And one thing is that we really have to listen to our women, because they know their bodies. And they know when something is not right. So we may look and see nothing and say everything looks great, right? But this woman is telling you that something is not right. So we really have to listen to them, because they know their bodies.
Absolutely. And, speaking on that, so I've had where the vaginal cultures come back negative. They continue having these symptoms. We've checked for the traditional STDs, gonorrhea, chlamydia, trichomonas, all negative. They keep having symptoms, no UTI. And finally, we checked something called mycoplasma, and that was positive. I treated them, and voila, their symptoms have been gone since then. So I thought that was very interesting. Do you see that in your office?
We see that daily.
So
really with us, because this is what we do, right? We're women's healthcare providers. We do that culture with every culture. We don't wait now for women to come back recurrently 3-4 times. We do test for ureaplasma and mycoplasma on a daily basis as part of that, because we see it all the time. Now, ureaplasma or mycoplasma can be a normal flora too. So unless a woman's symptomatic, I'm not going to go ahead and treat them and wipe out their normal flora unless they're complaining of something. So just like you're saying, is you found it out of process of elimination because they were negative for everything else. You found it, you treated, it went away. Those women were symptomatic.
Exactly.
But if I find it routinely on someone that's not, I'm not going to just treat them and wipe out their normal flora.
I love it.
It used to be a normal thing that we tested for infertility, because we used to think it was more of a sexually transmitted thing and that it could cause a lot of problems for infertile couples. But now we see it so routinely, we know it's a normal flora in the vagina, and we do know that it can cause women a lot of symptoms.
Wow. Good. Yeah, ever since then, I've now checked it. I don't make them come back 5 times.
Exactly.
I'm like,
it should be part of our normal routine.
Exactly. And, I do always educate, too, that even if you're with in a monogamous relationship, it doesn't hurt if you continue to have recurrent symptoms. Do not be afraid to check for STDs, even gonorrhea, chlamydia, or trichomonas. I mean, it's something that you just need to be able to be comfortable with your provider to discuss this.
Absolutely. And what happens with the mycoplasma or the ureaplasma is when you call a woman that is a married woman in a monogamous relationship, she Googles it, right? Because Dr. Google is not your friend. And then she calls back and she's alarmed because a lot of times it is categorized as an STD. And we certainly know that it is not, that it is part of our normal flora. And again, that's just lack of education. So we have to calm them down a little bit after that conversation.
Yes.
Sometimes.
Yes. And with the, now let's talk about that. Actually, I'm glad you alluded to this. So what vaginal conditions is it necessary to treat the partner?
So we used to think that you had to treat the partner for BV, right? We used to think that for recurrent yeast infections. We now know that that's not true.
Right.
And we do not treat the partners. We do not treat the partners unless a woman is coming back with recurrent things. And then they'll say, could you just treat my partner and let's see what's happening? And are we passing it back and forth? But I'm a nurse practitioner for women's health for 30 years. And there was many times back in the day where we would just frequently just treat the partners, and we were really not doing, doing them right by that.
Exactly.
Yeah.
Right. So I just, pretty sure it's more just like the STDs, like gonorrhea and chlamydia, and trichomonas I believe is recommended to treat the partner as well.
Yeah. So if we're positive for any type of STD like chlamydia, gonorrhea, or trick, I always treat the patient. That's who I'm taking care of, right? And then we recommend that the partner gets treated as well. And we recommend that they don't have any relations until they're both tested again to make sure that the infection is all gone.
Exactly.
And because I am in a private practice and these patients, they really do care about their health care, they're going to come back and they're going to get tested again. But there are so many women out there that don't have that practitioner that they're comfortable with. And they may not go back to a clinic or to get treated or get a test of cure. And that's just so important because sometimes they just keep passing it on to others.
Absolutely. And what about, let's see, how can we discuss the difference between woman's normal discharge versus something that's different? Like you mentioned this in this menstrual cycle, and I think you could maybe say how our discharge actually changes throughout a menstrual cycle.
Yeah, it changes throughout your whole cycle, right? And a lot of women have a normal discharge on a daily basis. Young girls specifically, I do a lot of adolescent gynecology. I love taking care of young women. They'll come in and they'll say, I see discharge on my panties every day. And they're in a panic until they actually learn that that can just be a normal hormonal change that their body's going through, that they don't have an infection. And sometimes you do have to do a culture to prove to them that they do not have an infection, that it's part of their normal flora.
Yeah. And I know like during your cycle, some of the discharge can actually get thicker, almost like I always say, it's kind of gross, but if you were to put it between your fingers, it could be sticky, or it could be extra thin during your ovulation cycle.
Right.
And that's the natural path.
That's the natural progress of what happens to us as women, and our discharge changes.
It's the beauty of what the body is doing to try to help you get pregnant.
Exactly, right? During ovulation, your discharge is going to be very watery, very thin, stretchy. We describe it as like egg whites because it is really stretchy, and that is a woman's most fertile time. And so that would be a normal discharge for them, not something that needs to be treated.
Now, do you have any recommendations? Like, do you believe that what we eat or what we drink can impact the vaginal flora?
100%. I believe that diet, exercise, everything can impact our vaginal flora, right? Anytime our immune systems are compromised, our vaginal, integrity is compromised. So I talk to women all the time about diet. I'm huge about diet and exercise. This is what I do. This is what I talk about because I think that that is one of the, main things that's going to keep us healthy for everything. Mm-hmm. Keeping our digestive health healthy, in turn, will keep our vaginal health. Just keeping everything kind of in sync is going to make us be able to fight things off much better, right? Because if we have a good, healthy immune system and we're eating right, we're exercising, we're stress-free.
I was just going to ask about stress
We
next.
are going to be able to fight things off a lot better. Yeah. In today's world, who's really stress-free, right? So I have to talk to women all the time about exercise and balance and keeping ourselves as stress-free as possible. And that's whatever, exercise you choose to do. If I don't exercise on a day, my staff knows it, right? Because it's what keeps me calm. It keeps me in a good place, and it allows me to function and just be calm throughout the day. So that is my fix, right? What I do. So I try to talk to women about that all the time, is that that's a great thing for you. And it doesn't have to be a hard, extensive exercise. Right. You can do meditation. You can do yoga. Anything that's going to put yourself in a good mental state. Because believe me, mental health is so important. And when we're stressed and our mental health is off, then our bodies are compromised, our immune system's compromised, and it just is just a cascade of events.
Absolutely. And, going back to the diet, I believe, diabetics who tend to have higher sugar content within their body and or tend to eat more sugar or carbohydrates. People don't realize that what follows sugar is yeast. And so I think diabetics tend to be more prone to yeast infections or, what we call candida infections. And certain medications out there can actually cause people to be more prone to infection. Like now we have SGLT2 inhibitors, which we treat for chronic kidney disease like Farxiga or Jardiance. Some people are on it for heart failure or diabetes. And those medications make you pee out sugar. So you're more prone to, if you leak at all, then that yeast, you're more prone to a yeast infection or urinary tract infection. So you have to be aware as well of your medications that you're on, possible symptoms of them, and then your state as well of knowing like high fructose corn syrup and refined grains is going to attract yeast.
Yeah. And a lot of times we diagnose diabetes because we're gynecologists, right? That's not something that you're looking for on a daily basis. But women come in with chronic yeast infections, and I test them for diabetes, and I test them for HIV and other things that can, interfere with their immune system, because we know that long term that can affect them. And so I will sometimes diagnose a diabetic, and they're like, how did your gynecologist, diagnose that? And it's just because of what led up to the events that we went ahead and we tested. So it's just our whole body is involved, not just the vagina.
Right. And then, so do you find that hydration matters too, like staying hydrated, or versus people who tend to not drink enough water? Is there any correlation there?
Again, same thing. Yeah. We've got to hydrate our bodies. We've got to keep our tissue moist, right?
Exactly.
The vagina is tissue. It's our vaginal tissue. We've got to moisturize it. When we get out of the shower, we put lotion on every day. We moisturize our skin. Tell me that people do not moisturize their vaginas on a daily basis. There are actually vaginal moisturizers that women use, and it doesn't just have to be that postmenopausal woman that's using that. It can be used for anybody.
So let's talk more about that too. Like vaginal dryness, I don't think people realize how that alone can create a slew of issues. Our lining needs to be moist. And when we hit menopause and we lose that estrogen, you can start to have what we call vaginal atrophy, like drying up, and, it doesn't stretch as much. Like lubrication is key to prevent infection and urinary tract infections and pain with intercourse, abnormal bleeding, right? So
yeah, just good vaginal health.
Exactly.
Right? Doesn't matter what age you are.
Exactly. Right. So what are some of those vaginal moisturizers that you might recommend for some people?
Yeah, there's so many different ones available now. And again, when you think about vaginal dryness or vaginal atrophy, you're thinking of that postmenopausal woman, right? Because what did I share with you before about the menstrual cycle? That once that estrogen kicks in, our own lactobacillus kind of normalizes and goes back to the way that it should be for that next couple of weeks while that estrogen is working. And so when a woman becomes menopausal, they lose that estrogen, and so they have no estrogen, and that's why it becomes very dry. We also see a lot of vaginal dryness on young women on birth control pills. And so they come in, and not a whole lot of providers pick up on that and know that, oh, I'm having this dryness or this pain with intercourse because of something that's going on with me hormonally. They think, oh, you're 25, you're not supposed to have that, and kind of just dismiss it. Yeah, and not really deal with those issues. So I recommend vaginal moisturizers a lot. There are so many different ones that you can get over the counter, you can get online. And most of them, believe it or not, have hyaluronic acid in it. And what hyaluronic acid is, what did I tell you before, is that I want to keep that
pH.
Yeah, I want to keep that vagina slightly acidic. And so when you're using those moisturizers, it's doing the work for you. It's maintaining the pH, and it's keeping the vagina moist, and it's preventing you from getting infection and long-term, conditions. So it works well.
How do you feel about using something natural like coconut oil or hemp oil?
I do recommend those too. So, and I always try to have them try those things first.
Right.
And so I always say, let's try some natural things first. And then if that doesn't work, then we have some other things, because some women can't afford to purchase these products, on a regular basis. Or if you go online to some of these companies, they put you on like an automatic refill where they're sending it to you monthly.
Yeah.
And a lot of women don't want to do that, or they don't have the means to be able to pay for it. So I always try to do natural things first.
Yeah. I know some people use olive oil, and I just recommend using a panty liner so it doesn't stain your undies.
Yeah,
right?
100%.
So what are some other things like, pelvic floor exercises? Do you recommend that sometimes to help improve the vaginal health?
Yes, absolutely. So I had a patient once that came in actually for a second opinion, and she was having a lot of recurrent issues and was, again, just treated with cream after cream or antibiotic, and the whole flora was wiped out. And when I actually did an inspection or exam on her, she actually had issues with the pelvic floor and the muscles. And we referred her for pelvic floor therapy because it all goes hand in hand. And once she got everything kind of working back to the way she was supposed to, all of her symptoms resolved. So I love pelvic floor exercises, and I never just dismiss it, because we used to think that women that needed pelvic floor, or women that have had 5 babies, or postmenopausal women, but it can be for anybody. And again, it just depends on the circumstances. My own children were gymnasts, and they used to pound and pound and pound on hard mats, right? They would tumble and pound, and their pelvic floors were so weak before they even had babies, just because of what they did for years. They would complain of incontinence and other symptoms before they were even in their childbearing. And so, again, unless you really know about the pelvic floor and talk to these women about what they do on a daily basis, you don't realize how that pelvic floor can be beat up just doing other things.
Right. It's amazing.
Yeah.
And so, one thing we haven't talked about is, prolapse, right? So there's different types of prolapse. Women have our rectum, we've got our bladder, and we've got our uterus, all in that vicinity. So do you see how sometimes having a prolapse of one of those organs, which is basically weakening of the muscle wall to hold them up, right? So they can sink into the vaginal cavity, right? Do you see how those can cause like more discomfort, pelvic pain, discomfort, irritation?
Yeah, and they actually come in thinking they have an infection, right? Or they feel a lot of pressure. That's one of the biggest complaints, is they complain of pressure. Why? Because their bladder's a little low, right? And they don't even realize that. So they think that they have a urinary tract infection because of that pressure in that bladder, where it's just actually they have a little bit of prolapse because of the weakness in their pelvic floor. So if we start talking about it early, we send women for pelvic floor even after they've had 1 baby, because we know that through time and gravity and aging process, it could get worse. So it's definitely something that you want to evaluate. Yeah. But I love that you're thinking that, because they come in all the time and they think their uterus is falling out.
Absolutely.
Right? And they'll say, oh my God, I just looked in the mirror. I see my cervix. You need to help me. And I'll say, that's not your cervix. That's your normal vaginal rugae. However, your bladder does hang a little low. So they don't realize that the bladder can do that. The rectum can do that, and then the uterus. They automatically go, because of Dr. Google, is they think the uterus is falling out.
Yeah.
Or with the rectum, one of the biggest symptoms that women have is they tend to have constipation, right? Because that stool can get caught up in that prolapse, where it kind of just bulges into the vagina. And they're like, I feel this pressure there, and I'm constipated a lot, and it can be a rectal prolapse. So it's just accurately assessing them and teaching them.
Right. And then that can cause become almost stone-like and hard at times.
100%, because it gets stuck in there, and they don't even realize that.
They're not able to evacuate it completely. Right. Yeah. I'm telling you, women are complex.
Yes. And pelvic floor is huge.
And so what about, we talk about yoga, and I feel like even when people aren't doing yoga, we are all wearing yoga pants. So tell me about how, do you feel like tight clothing or synthetic fabrics are affecting our vaginal flora?
It doesn't allow the vagina to breathe. Right? So again, part of our hygiene or our education is we're really encouraging women to exercise, but I'm also encouraging not to stay in their wet clothing for long periods of time. That can even be a bathing suit, right? It doesn't have to be yoga pants. It doesn't have to be jeans. It can be just a bathing suit where they sit in that wet bathing suit for long periods of time. And again, we talk about the vagina. And where does bacteria and yeast grow best? In a dark, moist environment. That's what our vagina is. Our entire cavity is internal. So everything is there. If you go to the gym and you exercise and then you've got these moist pants and then you go to Target on your way home or you go to breakfast with friends and then you go to pick up your kids at daycare. So you realize you've been in those pants for now 7 hours and that moisture has just stagnated there and it's creating an environment where bacteria and yeast are going to multiply. And so we've got to talk about good hygiene.
And on top of that, most of the time they're wearing thong panties so they don't see the underwear line.
Right.
And then that's just bringing E. coli from your rectum straight up.
It is
in
not
between.
allowing anything to breathe. Exactly.
Right.
And how about, let's talk about shaving? Because I have this conversation with my young women all the time because this new generation, they want to shave it all off.
Yes.
We have hair there for a reason. Right? The hair there is our protective mechanism. And if you tell a young woman to stop shaving, she's going to look at you like you have two heads, right? And I said, you don't have to have long hair. Trim it, do something, but you don't have to shave it all off because what you're doing is actually creating an environment for infection. That hair is there for a reason. So that takes a lot of education with women.
I'm sure.
Some of the older women were good with that, but this younger generation, they don't like hair anywhere.
Yeah. And Brazilian waxing and whatnot.
And they don't realize that when you put that wax on there and you tear that off, you are creating an entire environment for infection, right? In those hair follicles.
Yep.
And we don't even realize what we're actually doing to our bodies.
Yep. It makes sense. And so I wanted to also talk about what about like menstrual cups, tampons, pads? I know I personally switched to 100% organic cotton recently because I was thinking I'm like, okay, here we are putting tampons